Professionals, meanwhile, have additional ideas, some things to add to that. Here's one of them. Increase the use of telemedicine. What does that look like exactly, and could it be used effectively to fight the coronavirus? Should you use it? Dr. Brendan Carr is the chairman of emergency medicine at Mount Sinai Hospital, and he joins us today. Doctor, thanks so much for coming on. For those of us who aren't familiar with what this means, could you just explain it? What is telemedicine?
Sure. It's letting technology allow doctors to talk to patients much the way you and I are talking right now. It puts me in the same room with you, whether we're in the same city, in the same state or not. Lets me take a history, talk to you about what's on your mind, and put a plan together for what needs to happen next.
It's such an obvious idea since everyone, you FaceTime your kids.
Yes.
Why hasn't it been used on a widespread basis before? Maybe it is. And I didn't know.
It's used for a number of things. It's used for a lot of times to put a subspecialty consultant in a room in an emergency department in a rural area. It's one of the most common ways we think about using it. In this case, for coronavirus, it's very helpful to allow a specialist to talk to you about what your symptoms mean, whether you need to be tested, how you should treat yourself. And I guess I would say if you need to be tested, everybody knows it's difficult right now to get tested. This allows us to start to bring some order to that chaos. We can set up an appointment for you, tell you to come in to a testing visit. You can come in, come out, decrease the amount of interaction that you have with staff, with the outside world, decrease the spread of the virus.
There have got to be an untold number of Americans who are convinced or semi-convinced they may have this disease, whether they do or not.
Yep.
Can they take advantage of this to either confirm or allay their fears?
You know, I've done a lot of telemedicine visits, and I get asked one question over and over, and that question, phrased lots of different ways, is, should I be worried? And most of the visit, and I'm not just talking about coronavirus, I'm talking about all the time. And most of the visit is spent with the doctor educating the patient asking questions, and then collaboratively putting together a plan. So the specific answer to your question is 80+% of people have mild symptoms. People who have mild symptoms and are at home, it's a good question about whether or not they need a test. What they need is to have their fear addressed, and the portion that gets sicker, the portion that need a test, need to have that coordinated for them.
I know a couple of people personally who believe they've been exposed to coronavirus and can't get tested for it, or haven't been yet, despite trying. Does that concern you, and is that widespread, and if so, why?
You know, the truth is, it concerns all of us. We think that we need to have a better handle on how widespread the disease is. But the truth is, whether you have coronavirus or not, when you present to me in the emergency department, I take care of you the same way. Does that make sense? I'm going to resuscitate you and do the things that I need to do. We don't have a cure for this. We treat your symptoms. Right? So whether or not you have the diagnosis or not based on a test doesn't change anything that I would do. And frankly, if you have mild symptoms, doesn't change what you would do at home. You would isolate yourself. You would be very careful about hand hygiene, about coughing, about exposing yourself to other folks, especially the people who are at the highest risk. Older adults, people with underlying medical problems.
You're a very good explainer, and I really appreciate that.
Thank you very much.
Thank you. Good to see you, Doctor.
Thank you. Nice to